What happens to your body when you use baking soda for 30 days? Did you know that something as simple as baking soda could shift how your entire body functions in just 30 days? We're talking about the same powder you keep in your kitchen cabinet, which is cheap, easy to find, and surprisingly powerful. Most of us think of baking soda for cleaning or baking, but when used correctly inside the body, it may do so much more. From improving your energy levels to helping your kidneys work better, this natural compound interacts with your blood, muscles, immune cells, and even your skin in ways you might never expect. In this video, we'll tell you the 10 most surprising things that happen when you use baking soda daily for 30 days. But here's the important part. Baking soda isn't for everyone, and using too much may be risky, so always consult a healthcare professional before trying this. Now, let's get started. 1. Blood pH regulation. Most people don't realize your blood works hard every day to stay slightly alkaline, and baking soda may quietly support that balance within 30 days. When you use it consistently in small amounts, it acts as a buffer that helps neutralize excess acids in the bloodstream without throwing your system off course. The key here lies in sodium bicarbonate's natural ability to bind with free hydrogen ions, which are the primary contributors to acidity. When these ions are reduced, your blood maintains a more stable pH range, usually around 7. This shift isn't drastic, but it is enough to reduce the burden on organs like your lungs and kidneys, which are constantly adjusting to keep your internal environment in check. One of the lesser-known strengths of baking soda is its ionic nature. The bicarbonate ion in particular plays a direct role in your body's buffering system. It works closely with carbonic acid to form a reversible chemical reaction, giving your body a reliable tool to respond to daily pH fluctuations. Science Direct say that baking soda helps keep the right balance of acids and bases in the body. It is also FDA approved to treat problems like ulcers, constipation, acidosis, and epilepsy. 2. Reduced muscle fatigue. Most of us have felt that burning sensation in our muscles during a workout, but baking soda may actually help you push through that wall. When used in controlled doses over 30 days, it helps your muscles fight off fatigue by buffering the acid that builds up during intense physical effort. During exercise, especially high-intensity moves like sprinting or lifting, your muscles produce lactic acid. This lowers the pH inside muscle cells, making them more acidic and harder to contract. That's when fatigue sets in. Baking soda, through its bicarbonate content, helps neutralize this acid by soaking up the excess hydrogen ions, which are responsible for that drop in pH. One more important thing is that it has sodium in it. While often overlooked, sodium plays a key role in transporting bicarbonate into your cells and maintaining electrolyte balance during exercise. This supports better muscle firing and reduces cramping or early burnout. A study published on ResearchGate found that sodium bicarbonate noticeably slowed the rise in fatigue index among badminton athletes after intense anaerobic training, pointing to its ability to delay exhaustion by keeping muscle pH stable and buffering acid accumulation during performance. Now that we've hit the second health point, we'd love to hear your take. How does baking soda play a role in your daily health? Let us know below in the comments. 3. Relief from chronic acid reflux symptoms. For anyone dealing with that constant burning in the chest after meals, baking soda might offer surprising relief when used consistently over 30 days. What makes it work is its fast-acting ability to neutralize stomach acid before it travels up into your esophagus. When hydrochloric acid in your stomach rises too high or leaks past the lower esophageal sphincter, it causes that painful reflux sensation. Baking soda steps in with its alkaline makeup to buffer this excess acid. Its bicarbonate ion reacts with the acid to form water and carbon dioxide, easing that discomfort almost instantly without relying on synthetic antacids. What also helps is the rapid solubility of baking soda in water. When mixed properly and taken after meals, it spreads quickly through the stomach, coating the lining and calming irritation caused by acid splash. According to research, drinking about 1.5 liters of mineral water with baking soda every day for 6 weeks helped reduce heartburn in adults. People who had frequent heartburn felt much better and said their daily life improved while using it. 4. Oral health improvements. Your smile may actually benefit from something as simple as baking soda when it's used regularly and correctly for 30 days. This everyday powder supports oral health by targeting 2 major troublemakers, acid buildup and harmful bacteria. When the pH inside your mouth drops after eating, especially sugary or starchy foods, it creates an acidic environment where tooth enamel weakens and bacteria thrive. Baking soda's alkalinity helps bring that pH back to a healthier level, making it harder for cavities and gum disease to take hold. This shift creates an environment that supports remineralization and better long-term enamel protection. What also makes baking soda effective is its mild abrasiveness. It's strong enough to lift surface stains and break down plaque without damaging your enamel when used gently. This helps brighten your teeth and gives you a cleaner, smoother feel after brushing or rinsing. Wiley's research found that using baking soda toothpaste just once cut down on plaque formation by a large amount and showed some improvement in gingival bleeding signals. This suggests that using baking soda to clean your teeth every day might be a good idea. 5. Improved renal function. Not many people realize that baking soda may actually support your kidneys when used carefully over the course of a month. For those in the early stages of kidney issues, this simple compound may help reduce the stress on these vital organs by balancing the acid levels in your blood. As your kidneys work to filter waste and regulate pH, chronic low-grade acidosis may wear them down. The bicarbonate in baking soda helps offset this by neutralizing the extra acids before your kidneys have to process them. This takes some of the workload off the nephrons, the tiny filtering units, allowing them to function more efficiently over time. Baking soda's sodium part is also very important. While too much sodium may be harmful, in controlled amounts, it plays a role in fluid balance and helps with transporting bicarbonate into the bloodstream. That movement helps stabilize pH, easing inflammation and slowing damage inside kidney tissues. Over 30 days, this gentle support may help slow the decline in kidney performance and may even improve filtration efficiency in those with mild to moderate impairment. One study shows that oral sodium bicarbonate not only improved serum bicarbonate levels in patients with chronic kidney disease, but also slowed the decline in kidney function over time. 6. Enhanced urinary tract health. What surprises many people is how baking soda may gently support your urinary tract when taken consistently in small, safe amounts for a month. When your urine becomes too acidic, it may irritate the bladder lining and create the perfect setting for bacteria to grow, especially during a urinary tract infection. The bicarbonate in baking soda helps raise the pH of your urine, making it more alkaline. This shift may slow bacterial growth and ease that painful burning sensation during urination. Moreover, it also works well because it may lower inflammation caused by acid. As baking soda buffers excess acid in your bloodstream, it indirectly calms the lining of your urinary tract by reducing irritation triggered by high acidity. It assists in managing fluid movement and helps stabilize internal pressure within your bladder walls. Over the course of 30 days, these changes may lead to fewer flare-ups. According to PubMed, taking baking soda by mouth helped improve bladder symptoms in women. It reduced issues like urgency, frequent urination, nighttime trips to the bathroom, and even incontinence. It worked by raising the pH of urine without changing blood pH, and after 4 weeks, women reported feeling better and had an improved quality of life. 7. Reduction in systemic inflammation markers. Baking soda has the power to calm down chronic inflammation when used consistently over 30 days. It actually works deep within your immune system, helping to dial down unnecessary immune responses that may harm your tissues over time. Inside your body, the spleen plays a major role in regulating inflammation. Baking soda influences cells in the spleen and blood, encouraging them to shift from pro-lymphosis to anti-lymphosis activity. This happens because the bicarbonate interacts with mesothelial cells, which line your organs and help communicate with immune cells, signaling the body to stop treating normal activity as a threat. What also makes baking soda effective is how it stimulates the vagus nerve. That's the nerve that links your brain to key organs and helps trigger the cholinergic anti-inflammatory pathway. When this nerve is activated, it reduces the release of inflammatory cytokines, which are often high in people with autoimmune or metabolic conditions. A study found that taking baking soda by mouth may trigger anti-immunity pathways in the spleen. This means it may help calm down inflammation by changing how the immune system reacts, pointing to a new way baking soda could support immune balance in the body. 8. Enhance skin clarity and reduced itching. Clearer skin and relief from constant itching may not be the first things you think of with baking soda, but its effects on the skin may be surprisingly powerful when used the right way over 30 days, especially in the form of soothing baths or diluted topical applications. Baking soda's natural alkalinity helps neutralize skin surface acids that may irritate the outer layer of your skin. For people with conditions like eczema or psoriasis where the skin barrier is compromised, this mild alkalizing effect may reduce stinging, calm redness, and ease inflammation by stabilizing pH at the skin's surface. An additional feature that stands out is the fine particle texture. Unlike harsh scrubs, baking soda dissolves easily in water, creating a gentle barrier that may reduce friction and help reduce histamine semen itching. It also acts as a mild antiseptic, which may help prevent secondary bacterial irritation in inflamed or broken skin. If you have eczema, the National Eczema Association says to soak for 10 to 15 minutes in a warm bath with a quarter cup of baking soda added to it. Because of this, it is best to minimize any risk by moisturizing the skin after gently drying it. 9. Potential reduction in uric acid levels. What's fascinating is that baking soda may help lower uric acid levels, a key factor in managing conditions like gout, when used in moderation over 30 days. When uric acid levels rise in your blood, they may form sharp crystals in joints, triggering intense pain and inflammation. Baking soda helps by increasing the pH of your urine, making it more alkaline. This alkalization process dissolves uric acid more easily, allowing the kidneys to filter and excrete it before it builds up in your system. One of the most helpful components here is bicarbonate, which directly interacts with uric acid during excretion. It not only boosts solubility, but also prevents uric acid from forming into stones or crystallizing. Alongside that, baking soda's sodium content subtly aids in fluid movement and kidney filtration, helping your body get rid of waste more smoothly. According to the National Library of Medicine, taking baking soda by mouth helped lower uric acid crystals in adults with type 1 diabetes by raising the pH of their urine. This means it could help stop uric acid from building up, something that's often linked to kidney damage in people with diabetes. 10. Mild antiseptic effects. Most people don't realize that baking soda may gently support your body's defenses with mild antiseptic effects when used regularly for 30 days. While it's not a replacement for medical treatments, its natural properties create an environment that's less inviting for harmful microbes to thrive. The secret lies in baking soda's ability to alter pH. Its alkaline nature helps raise the pH of skin or mucous surfaces slightly, making it harder for bacteria and certain fungi to survive, since many of them prefer more acidic surroundings. This effect has been shown to help reduce bacterial load when used in diluted rinses or soaks. Another important factor is its chemical reactivity. When baking soda dissolves in water, it releases sodium and bicarbonate ions that may disrupt microbial membranes and slow down their growth. This makes it a useful agent for gentle wound care, oral rinses, or even underarm use to manage odor-causing bacteria without relying on synthetic chemicals. A study published in PubMed found that 10 grams per liter of sodium bicarbonate stopped 56 different types of fungi that cause skin and nail infections. Moving on, let's discuss how to use baking soda safely for 30-day health benefits. If you're wondering how to actually use baking soda to get these benefits, you're not alone. We've covered what it may do, but now it's time to talk about how you may make it part of your routine safely. 1. For blood pH balance. Mix 1/4 teaspoon of baking soda in 8 ounces of water and drink it once daily on an empty stomach. This mild dose helps support your body's natural buffering system, keeping blood pH stable. Always avoid high doses and monitor your intake if you're on a sodium-restricted diet. 2. For muscle fatigue and endurance. Take a half teaspoon of baking soda dissolved in 8 to 10 ounces of water about 60 to 90 minutes before your workout. This timing gives your muscles a head start in buffering the lactic acid produced during intense activity. This method is often used in sports, but it should be done under guidance, especially if you're sensitive to sodium. 3. For acid reflux relief. Use 1/4 teaspoon in a full glass of water after meals, no more than twice a day. This may help neutralize stomach acid that may be backing up into your esophagus. It's ideal for those with occasional reflux, not long-term use. Avoid taking it right before or after eating large meals, and never exceed the dosage as it may lead to bloating or alkalosis. 4. For oral health support. Create a paste with a small amount of baking soda and water, just enough to brush your teeth once daily, or use it as a mouth rinse by mixing half a teaspoon in 4 ounces of warm water. Limit use to a few times per week to avoid overabrasion, and always follow up with regular toothpaste. 5. For kidney function support. If you have early-stage kidney disease and your doctor approves, take about half a teaspoon in water once daily. The goal is to gently support blood bicarbonate levels, which helps prevent metabolic acidosis and reduces the load on the kidneys. This method should only be used under medical supervision, especially for those with hypertension or advanced kidney issues. 6. For urinary tract comfort. Use half a teaspoon of baking soda in a glass of water once per day during the first signs of discomfort. This may help raise urine pH, making the bladder less acidic and reducing irritation during urination. The bicarbonate reduces acid inflammation, while the sodium promotes fluid movement to help flush out mild bacterial buildup. 7. For inflammation control. Take half a teaspoon daily in water for up to 4 weeks under the guidance of a healthcare provider. Baking soda stimulates the vagus nerve and influences spleen function, leading to reduced production of inflammatory markers. It's especially helpful for people dealing with chronic low-grade inflammation linked to autoimmune conditions or metabolic stress. 8. For skin irritation and clarity. Add 2 tablespoons of baking soda to a warm bath and soak for 15 to 20 minutes, up to 3 times a week. The alkalinity reduces irritation, and the gentle granules help remove dead skin cells without harsh scrubbing. It's a great option for those with eczema, psoriasis, or allergic flare-ups, but avoid it if you have broken skin or very sensitive skin types. 9. For uric acid support. Mix half a teaspoon in water once daily between meals. This encourages the kidneys to excrete more uric acid by raising urine pH and preventing crystal formation. This method may help reduce flare-ups in people prone to gout, but must be monitored closely due to potential effects on sodium levels and blood pressure. 10. For mild antiseptic benefits, use baking soda in diluted form for topical rinses, such as a foot soak or gentle wound rinse. Add 1 teaspoon to a small bowl of warm water and apply with a clean cloth or soak the affected area. Its mild chemical action helps cleanse without stinging, making it useful for sensitive skin or mild irritation. Always rinse afterward and avoid deep wounds or infections that require medical care. When you use baking soda mindfully, you'll be surprised at the range of benefits it may offer, from supporting your gut to helping your immune system stay balanced. We're not talking magic, but real science-backed effects that happen when your body responds to this natural compound. That said, there's a fine line between helpful and harmful. If you take too much or use it the wrong way, it may do more harm than good. That's why it's so important to understand your limits and keep a close eye on how your body reacts. Long-term use should always be discussed with a healthcare professional to make sure your system stays in balance and nothing gets disrupted. In this amazing video, we learned about all the good things that happen when you use baking soda for 30 days. But did you know that there are many ways to protect your health? Want to find out more? Watch 10 foods you should never eat that will damage your health. Or watch Avoid eating eggs if you suffer from these 5 health problems. Watch one, or even better, watch both. Do you also use baking soda? Let us know in the comments below.